Do you know the early warning signs of prostate cancer? It's a question that every man should ask himself. Prostate cancer is a serious disease that develops in the prostate, a small gland that produces seminal fluid in men. It's one of the most common types of cancer, affecting countless individuals worldwide. The unsettling part is, it often exhibits no symptoms in the early stages. However, early detection is key to successful treatment and survival. Knowing the warning signs can potentially save your life or the life of someone you care about. This video is designed to provide you with the essential information about the early warning signs of prostate cancer. We'll go through each sign so you can better understand what to watch out for. The knowledge gained could be the difference between catching this disease early or not catching it at all. So are you ready? Let's dive into the early warning signs that every man should be aware of. The first sign to watch out for is frequent urination, especially during the night. Now let's talk about why this happens. Picture the prostate, a small walnut-sized gland in men. This gland surrounds a part of the urethra, the tube that carries urine from the bladder out of the body. When the prostate is healthy, it aids in the production of seminal fluid, a key component of ejaculation. However, when the prostate becomes enlarged, it can press against the urethra, causing discomfort and urinary problems, one of which is frequent urination. This is especially noticeable during the night. Imagine, you're deep in slumber, and suddenly, you're awakened by the urge to urinate, not just once, but multiple times. It's disruptive and certainly not normal. So, if you're finding yourself waking up multiple times during the night to urinate, it might be time to see your doctor. The second warning sign is having difficulty starting or stopping urination. Now this might seem like a minor inconvenience, but it's worth paying attention to. You see, the prostate gland, where prostate cancer originates, is nestled right up against the bladder and surrounds the urethra, which is the tube that carries urine from the bladder out of the body. If the prostate becomes enlarged, as it often does in the early stages of prostate cancer, it can press on the urethra and affect the flow of urine. This can make it hard to start peeing, cause a weak or interrupted flow, or make it difficult to fully empty the bladder. It's important to remember though that these symptoms can also be caused by benign prostate conditions, such as an enlarged prostate, which is common in older men. Problems with urination aren't always a sign of prostate cancer, but they shouldn't be ignored. The third early warning sign is a weak urinary stream. Let's dive into what this means. When your urine flow isn't as strong as it used to be, or if it takes a longer time than usual to empty your bladder, it could be a potential red flag. Now why does this happen? The prostate is a small gland that sits below the bladder and surrounds the urethra, the tube that carries urine from the bladder out of the body. When the prostate becomes enlarged, a condition known as benign prostatic hyperplasia, it can compress the urethra, leading to a weak urinary stream. This enlargement can sometimes be a symptom of prostate cancer, but remember, a weak urinary stream could also be caused by other factors such as aging or a urinary tract infection, so it's not always about cancer. However, if you notice a significant change in your urinary stream, it's important to consult with your doctor. The fourth and fifth signs are painful urination and blood in your urine. Now it's not uncommon to experience slight discomfort or see a change in your urine from time to time due to a variety of benign causes. But persistent pain while urinating or finding blood in your urine are symptoms that should raise a red flag. These signs can be indicative of a serious prostate issue, including prostate cancer. Pain during urination can be due to the growth of a tumor that's adding pressure to the bladder, while blood in the urine can be a result of cancerous cells disrupting the normal function of the urinary tract. Remember, these symptoms are not exclusive to prostate cancer. They can also be caused by urinary tract infections, bladder disorders, and certain medications. However, regular, persistent discomfort or seeing blood should never be dismissed as just one of those things. Experiencing pain when urinating or seeing blood in your urine should never be ignored. Signs 6 and 7 are erectile dysfunction and painful ejaculation. Now it's important to remember that these symptoms can be linked to various health issues, not just prostate cancer. However, when we're talking about prostate cancer, it can indeed affect sexual function. You see, the prostate gland plays a crucial role in sexual health. It produces seminal fluid which mixes with sperm to create semen. When cancerous cells develop in this gland, it can interfere with its normal function. Erectile dysfunction, or the inability to maintain an erection, can be one such result. Similarly, cancerous cells can cause inflammation or blockages, leading to discomfort or pain during ejaculation. It's crucial to note that experiencing these symptoms doesn't automatically mean you have prostate cancer. But it does signal that something's not right with your body. It's always a good idea to consult with your healthcare provider to rule out any potential issues. Changes in your sexual function can be a sign of a number of health issues, including prostate cancer. The 8th and 9th signs are persistent hip, back, or pelvic pain. Now you might wonder, how does prostate cancer cause discomfort in these areas? Well, the prostate gland, where this type of cancer originates, is nestled right in there with the hip, back, and pelvic regions. As the cancer progresses, it can grow beyond the prostate and begin to invade surrounding tissues. This expansion often leads to discomfort and chronic pain in these areas. This pain might feel like a dull ache, or it could be sharp and sudden. It might come and go, or it could be constant. Remember, our bodies are well-tuned machines designed to alert us when something is off. So, if you're experiencing persistent pain in your hip, back, or pelvic region, don't brush it off as just aging or overexertion. Listen to your body. Unexplained and persistent pain in these areas should always prompt a visit to your healthcare provider. The 10th and final warning sign is unexplained weight loss. Now, weight loss might seem like a good thing for many of us, but if you're shedding pounds without making any changes to your diet or exercise habits, it's a cause for concern. Unexplained weight loss is a common symptom of many types of cancer, not just prostate cancer. Here's why. As cancer cells grow, they can disrupt the normal functioning of your body. They might consume more of your body's energy, or they could interfere with the way your body processes nutrients from food. Either way, this can lead to weight loss. In the case of prostate cancer, weight loss can also be a sign that the cancer has spread to other parts of your body. This is known as metastatic prostate cancer, and it's a more advanced stage of the disease. Weight loss can be subtle, so it's important to pay attention to any changes in your body. If you're losing weight without trying, it's crucial to speak to your healthcare provider. So, to recap, the 10 early warning signs of prostate cancer are: first, we discussed frequent urination, especially during the night. This isn't always a sign of a serious condition, but it's definitely something you should bring up with your doctor if you're experiencing it regularly. Next, we highlighted the difficulties in starting and stopping urination. This sign is often overlooked, but it's important to pay attention to any changes in your usual routine. Thirdly, we dove into the issue of a weak urinary stream. This could be a sign of prostate cancer, but it could also be a symptom of other urinary problems. It's always best to get it checked out. Following that, we talked about the two symptoms that are often most alarming: painful urination and blood in urine. These are clear signs that something's not right and should be addressed immediately. Signs 6 and 7 are focused on sexual health, erectile dysfunction, and painful ejaculation. These can be difficult to talk about, but it's crucial to remember that your doctor is there to help, not judge. Next, we discuss signs 8 and 9, hip, back, and pelvic pain. While these can be symptoms of many different conditions, they can also be a sign of prostate cancer, particularly if they're persistent and unexplained. Finally, we touched on the 10th sign, unexplained weight loss. If you're losing weight without trying, it's important to get it checked out. This could be a sign of prostate cancer, or it could be a symptom of another serious condition. In essence, what's important to remember is that these signs are just that, signs. They don't necessarily mean you have prostate cancer, but they are indicators that you should consult with your healthcare provider. It's always better to be safe than sorry, and early detection can make a significant difference in treatment outcomes. Remember, early detection is key. If you're experiencing any of these symptoms, don't hesitate to consult with your healthcare provider.